coming. Are they coming or not? Should we go ahead?
Doc, let's start.
What do you mean?
I said, Doc, let's start. They'll join.
Hmm. Okay. So CT scans. So it's also one of the imaging modalities that will always come with a report. It will always come with a report. The main thing that I would want you to focus on in this lecture is to know when to request for a CT scan. That is one. And then number two, in certain emergency situations, like when you are suspecting a stroke or some form of head injury, sometimes the report might not be ready early. So in the absence of a report, you should be able to pick up what do you call it? A CV on a CT scan whilst waiting for the report, so I can start your treatment and not wait unnecessarily. And I think that's the number 2 point of this lecture. We are not going into detail with all the complex physics that it goes with. So then, we start. Okay. All right, so what's a CT scan? So CT scan simply refers to computed tomography. Computed tomography. So it's an imaging procedure that uses special X-ray equipment to create detailed pictures or scans of areas inside the body. So basically, a CT scan is just an advanced form of X-rays. An advanced form of X-ray. That's basically what a CT scan is. Okay. It's also called computerized tomography. Sometimes it's called computerized axial tomography, where you hear the word CAT. And the word tomography is coming from a Greek word tomos, that means a cut or slice. And that is because the CT scan cuts the body into various slices and shows you how the picture looks, various slices of various aspects of the body. And the graphian, of course, graphian means right. So tomography, so cut right or cut or slice right, if you want to interpret it literally. And so it's a non-invasive procedure or test, and it produces cross-sectional images of various parts of the body. And you are able to take image the whole body in just a few minutes. Okay, so each cross-sectional image represents a slice of the person being imaged. Just like you get slices of a loaf of bread. So we largely has what do you call it, therapeutic and diagnostic purposes. Now, they can be performed on every region of the body for a variety of reasons, as I've already said, whether to diagnose a disease, whether to plan treatment, like those who have, I hope you cannot hear me though, like those who have cancers and are going to have radiotherapy done, they use it to map out the treatment. And most of the time it's performed as an OPD procedure, just like all the other scans. And initially, at a point in time, it was called EMI scan because it was developed in a certain company called EMI that was founded incidentally doing one of their, that developed it for other purpose, but we have adopted it. Computed axial tomography, that is CAT or CT scan, or body section röntgenography. Body section röntgenography. So the cross-sectional images generated during a CT scan can be reformatted in multiple planes, and the images can be put together to create a three-dimensional image, which can be viewed on a computer screen or transferred to pen drives and the rest. Yeah, so even though we use it mainly in medicine, it has other applications in other areas of study. Okay, those who study fossils and the rest. Okay, so this is how a CT scan looks like. So right from the word go, you realize that some of the limitations of a CT scanner are that it has a very huge setup. You can see this machine, very huge. So you need a very big space, and it is very expensive compared to the cost of an X-ray machine. And you can see that it is really, really expensive, and it takes up more space than the traditional X-ray. Okay. So, well, whilst we are here, we can just take look at the various parts of the machine. So we have here, so this whole big thing is what we call the gantry, this big one here, okay? And this is the couch or the patient bed where the patient lies, and the patient will be passed through the bore in the machine, the space here. The bed will slide through. So as the bed is moving inside, then the X-rays will be taken shots of. But we'll look at that in a bit more detail later on. All right. No, so how does it work? So it uses X-rays, and the same principles apply to it, just like how X-rays work. The rays are shot from one end, and they hit the film at the other end. It's the same thing. And most modern CT machines take continuous pictures in a helical or spiral fashion. So as the person is passing through the machine, the X-ray, the gun that will be shooting the rays will be at one end, and then be going around the person, going around the person, and taking 360-degree shots around the person. The older ones had the gun at one point, which would be taking still pictures. But this time, these ones now have helical. They go around the person. All right. And of course, the helical ones give a better 3D image compared to the older ones that don't have a 360. That don't have a 360 scanning. And the newer ones have multi-slice and multi-detector and what do you call it, machines that are able to detect at multiple planes, and so they're able to give you your imaging much faster than the ordinary ones. The older ones. Okay. So digital geometry processing is used to generate a three-dimensional image of the inside of an object from a large series of two-dimensional X-ray images taken around a single axis of rotation. So, as I've said, if once the X-ray device is able to go around the person once, the images that are obtained, the computer is able to put it together to give a 3D view. Okay, and give a 3D picture. What is going on? So the CT produces a large volume of data which can be manipulated through a process known as windowing. So the process of manipulating data from CT is known as what? Windowing. Windowing. In order to demonstrate various bodily structures based on the ability to block the X-ray. Their ability to block the X-ray. All right. So just like we use the periodic table in comparison when we are talking about the X-rays. Over here also, the density of the material will determine how much of the rays it will allow to pass through. Okay. Now, So although historically the images were generated in the axial or transverse plane, orthogonal to the long axis of the body, modern ones allow this volume of data to be reformed. That is all the repetition of all that I've said. So the newer machines are able to let you get 3D. The first CT scans that came, you don't get 3D, but the newer ones, because of their multi-detector devices that they have and the multiple sources of the rays, you're able to have 3D generation of it. Okay. And sometimes also, depending on the structure that we are studying, sometimes we give what we call a contrast. We give a contrast medium. Sometimes we can give it IV, we can give it what do you call it, orally, or you give it as an enema. When we are studying hollow structures, for instance, if we are suspecting someone who has maybe duodenal atresia, for instance, you'd give a contrast dye for the person to swallow. That is more like a barium meal. The person will take it and then have the X-rays done, and that will delimit the bowel anatomy well. If maybe you are studying, you are suspecting diverticulitis, for instance, you may those ones you may give barium enema, and then you take the X-rays, and I mean the CT scan, and then it can well delimit the rectum and large bowel for you to see. And then also, if you are studying things like you have someone you suspect to have kidney stones or uriteric colic, those ones you'd want to give the dye IV, or you want to give a contrast IV, and then the kidneys will excrete it, and so from the calyces downwards, the dye will take the form of the, will delimit, and then you can see your stones well. Okay. So that is the use of CT contrast. We'll look at a few pictures later. So you can give it by mouth to swallow, you can give it IV, or it can be given as enema. All right. Okay, so this is also another picture that is showing you how it works. Okay, so the picture on the left is an older form of the CT scan, and the one on the right are the newer versions that we have. Okay, so in the past, you realize that so this is the gauntlet here, and the patient's bed here. So the rays will be shot from here. They will be passed on to the target rings, okay? And then it passes through the patient and is received by the detector ring, okay? By the detector ring. The newer ones, as I was saying, look at where the X-ray source is, okay? Then the receivers are here. So if you want to take a helical, shots of this one or axial slices, all you do is that the machine just rotates. Realize that if the patient is still and the machine is rotating around the person, you realize that at various points you get various angles, a 360-degree angle of any particular point in the body. Okay, so those are some of the helical ones. The newer ones, that is how they are. So those ones I would give us 3D imaging. Okay. So the procedure, I think I've written a bit more that. So the motorized table moves the patient through a circular opening in the CT imaging. So what do you call it? So the bed that the person is lying on is is motorized. So they press a button, and then the bed starts moving the patient through the thing like that, while the X-rays are being shot. Now, while the patient is inside the opening, an X-ray source and a detector assembly within the system rotates around the patient. A single rotation typically takes a second or less. During during rotation, the X-ray source produces a narrow, fan-shaped beam of X-rays that pass through a section of the patient's body. The detectors in rows opposite the X-ray source register the X-rays that pass through the patient's body as a snapshot in the process of creating an image. So when you have many organs and tissues. So there's all that I've just said again. So the thing just rotates around. The source and the detector, they will move around like that and take shots. Okay. Now let's look at the units of measurement. What do you call it? The CT scan is measured, or the density of substances or the matter that we are able to see on it are measured in Hounsfield units. Hounsfield units. And this is from Sir Godfrey Hounsfield, who designed the first CT scan. All right. So their design said that water has a Hounsfield unit of 0, whereas cortical bone has a Hounsfield unit of 1,000 plus. Okay. So what you see on the CT scan is that air on the other hand is minus 1,000 Hounsfield units. So just like for X-rays, air is at the darkest part, whereas cortical bone is at the whitest. I hope you are getting it. So it's also a range. So air will be the blackest, followed by fat, followed by water, before you have soft tissue, and then you'd have cortical bone, which would appear the whitest. It has Hounsfield units of 1,000 plus. Okay. All right. Okay, so this is another picture of how it is. So you realize that the imaging here is water is the baseline. Okay, so that is the 0. And then from there, you are going down to negative, or you are going up to positive. The positives will be more white, whereas the negatives will be more dark. All right. So what are some of the limitations? So soft tissue, such as in the knee, cannot be well differentiated. So typically, when you have to examine a place like the knee joint, you wouldn't use a CT scan, an MRI would be better. And then also, when the person has any metallic object, it can cause a starburst artifact. It will look like rays of light coming from it and distort your image. Then also an area of the body that is also poorly visualized is the posterior fossa. I'm sure you all know posterior fossa. Okay. And then also when it comes to brain matter, CT scan is not as sensitive as MRI. So therefore, if someone has, sometimes when a CVA has just started, or an infarctic stroke, sometimes in the early phases, a CT scan might not pick it up, whereas an MRI will be able to pick it up. So this is an example of how the metal artifact will look like. So this person, this is a CT scan of someone's jaw, so you can see the TTA. Okay, this is the TTA. But this person is wearing artificial teeth, those metal teeth they wear. So you see that shooting of rays. See, that's what we call the sunburst artifact. Okay. So the original users use it for the head, facial bones, but not. Remember that for the posterior fossa, it's not the best. Okay, if it is your primary area of concern, you're better off with an MRI. Okay, so you can use it for the neck, the chest, the abdomen, the pelvis, almost everywhere. The knee, but as I said, the knee is not the best use for the knee. Maybe I should look it up. Now, a very important thing you need to take note of is that for you to get a proper CT scan that report that will help you in whatever you seek to do with it, you need to write a proper request. So this is garbage in, garbage out. If you don't write a proper request, you may not get proper information. So you need to give a little history of the person so that the.
Hello, sir. We can't hear you well. Your line is not clear.
Hey.
Evans, it's from your side. If your internet is
From your side, though.
It's clear.
It's from your
It's
side,
clear.
Evans.
Wow.
Yes, dog, please.
Okay. All right. So as I was saying, so you need to give a proper history. So for instance, someone has come to you, the patient is unconscious. So you want to do a CT scan to rule out. You're not sure whether it is a stroke, you're not sure whether it is a meningitis, you're not sure whether it's traumatic, So a little history. So you write maybe, the age and stuff are there. So patient was said to have been brought in on account of has no fever, has blah, 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 and differential diagnosis. So if you write any history, ask for your differential diagnosis, you should write them there so that a radiologist who is doing it will consider all your differentials and actively look for them. In medicine, there are things that if you don't go looking for them, you won't find them, even though they may be there. And also, if you don't do that, what might happen is that the radiologist might see something, but because he doesn't know that it is of importance to you, he or she may not comment on it. And that is where, so don't just write CT scan and give to the patient to go and do CT scan. No. You need to give, also the same applies for ultrasound scan. If you write Bola, you get Bola. So make sure you always write a proper request. Proper request means that you are filling in the age, the sex, the date, and then also a short or a brief clinical history, and then also clinical what do you call parameters, history and exam, something brief, and then your differentials, okay, so that the radiologist will actively be able to help you rule out or include your differential diagnosis. I hope that is clear. All right, so let's look at some of the special applications of CT scan. Special applications of CT scan. I don't know whether I've written this one, but okay, I think it's somewhere. Okay, so one of the things we can use CT scans for is for 3D reconstruction. Okay, 3D reconstruction. Now, this patient for whom they were planning, wanted to look out for the kidneys and do a kidney transplant, so they're able to use the CT scan to generate a 3D image of the vascular supply of the person's, the kidneys, the major vessels in the body, all of them are set out nicely here on this 3D CT scan. So this is a 3D image. Also, they can use it for cardiac angiography. Do I have a picture? No, I don't have a picture. But they can also use it for cardiac angiography, where they will use it to do a 3D reconstruction of the various cardiac vessels. Then also, for those who are going in for radiotherapy, they use this to map out areas where they can implant the active material, for instance. Right. So as I've already talked about the contrast CT. So it helps to identify vascular structures and categorize certain types of pathology. We usually use it in the chest, such as in the CTPA. Have you heard CTPA before? CTPA. CT pulmonary angiography. So for instance, you are suspecting that someone has pulmonary embolism. One of the tests I can do is a CTPA. And that one is a contrast study of the vascular supply of the lungs. Okay, so that's in the chest. And that will let you know whether there is an embolus or not. Okay. It helps you look at the vascular supply. And also use it in the abdomen to delineate some of the structures like the kidneys, as I've said, the pelvis when you're suspecting tumors and the rest. We use CT scan. It's very good in helping us know the extent of metastasis of pelvic malignancies. Okay. Anyway, so we usually, so for the common one, the IV one. Hello. Okay, so for the IV ones, we usually use iodine. Okay, and it's important that before you give contrast, especially the IV, where the kidney is supposed to excrete it, you make sure you check your kidney function test. So when you're sending someone out to do CT and they will need a contrast, for instance, some of the head CT scans, IVU and the rest, you're better off letting them do kidney function test so that they don't go and waste time waiting for a kidney function test. Yeah, so this is what I've just said, CT angiography. So it's a CT reconstruction of the vascular structures in the body using IV contrast. And it's used to detect thrombosis, stenosis, aneurysms, vascular malformation, CT angiography. Okay, now this is CT angiography. Okay, this is typically a CTP. Now, if you look at this, okay, the contrast is the one that is showing white in the vessels here. But on the part that is circled here, you can see that there are some part of it that has a filling defect. There's some darkness here where the dye could not pass. Can you all appreciate it?
Yes, doc.
So this is how pulmonary embolism would look like on a CT. Because it would not, that place not be able to pick up the dye. So the thrombus is sitting here, not allowing enough blood flow to pass through. And there's another one. So over here, we don't see much of pathology. All right. Yes. So this is also a CT scan. Typically, when we have head injuries where there are skull fractures and the rest, when you ask for 3D reconstruction of the skull, you get a good image like this. And you can better be able to see the areas of the skull that are fractured so that you can plan your repair, or the neurosurgeons can plan their repair. So when you get, so you can see this person, this thing here showing how look at the various places where how the skull is fractured. Okay, so this is very useful for the neurosurgeons. Yes, then the other application we have for CT scans is CT guided biopsy. And I think we talked about the same thing in the ultrasound. Hey, remind me, we have to go back for the ultrasound. Let me tell you of some additions at least. So over here, there is a tumor in this person's lungs, okay? So they want to do a biopsy of it. So they put the patient in the CT machine, and then they're able to pass the needle right through into the tumor. Can you appreciate the syringe and needle so that they can take a biopsy of the tumor? So there's also an application of CT scan.
Yes.
CT guided biopsy will look like. All right, so I've just put here a little comparison between CTs and X-rays. So basically, to know, I mean, you can go through this one. So X-rays give us 2D images, primarily for bone and in the lungs to detect pneumonia, cancers, and then also perforation. I hope you haven't forgotten. If you have to remember, ask to list the indications for chest X-ray. Indications for chest X-ray. I hope that you will not forget to add the fact that it can be used to detect bowel perforation. Bowel perforation. When the bowel is suspecting perforated duodenal ulcer, is one of chest X-ray is one of the things we don't forget. So let me write it. List 10 indications of CTA. chest X-rays, and then also list indications for CT scan. That's what I was saying. So comparing the realized X-rays are more common and also of course cheaper. They will provide you 2D images. CT scans also pretty much a higher form of X-rays. They are just more powerful. They give you a 360-degree view. They can create 3D, and then they better off-see images, tissues better than the X-rays, of course. MRI, we'll get to that shortly. I mean, in our next lecture. Okay. So this is what I want you to take home. As I was saying earlier, in certain emergencies, when you do a head CT scan, for instance, you won't wait 24 hours for the report to come before you take action. Okay, so that means that you should get familiar with how a normal head CT scan looks like. Now, so these are pathologies that I have here. I hope you'll be able to appreciate it. Now, this is a head CT scan. This is a head CT scan. Now, so the white part you are seeing here is the cortical bone, that is the skull bone. The line you are seeing here is the fat. Okay, so left and right cerebral hemispheres. Now, if you look at the left side here, that doesn't seem to be much of a problem, but when you look here, I don't know if you can all appreciate what we are seeing here. Okay, so if you look here, you realize that this place, there's a dark demarcation here, and there's a white demarcation here. This is how subdural hematoma will show on a CT scan. It follows the curvature of the skull. Okay. Now, when blood is fresh, when blood has poured out fresh on a CT scan, because of the high iron content, it will show as white. Okay, to show as white. And when it stays longer, in a few days, the iron, what do you call it, is converted into hemosiderin and the rest. So you realize that it becomes darker. Can you see? So this is a chronic bleed into the subdural space, and there's an acute. So this picture is more of acute on chronic subdural hematoma. Okay, compared to the one on the right, where you realize that the bleed here is white. So this means that there's an acute subdural hematoma. The bleeding has just occurred. I hope you can all have. Can you all see the bone, the substance here? This is how a bleed looks like on the CT scan. There's an acute, this is chronic, and there's acute. So we call this acute or chronic subdural hematoma. So these ones, when you pick the CT scan, you should be able to tell immediately without waiting, assuming the person goes to do it in the night and has come. The radiologist obviously is not available in the night. So he'll come in the morning to come and write the CT scan. And you are sitting there waiting before you refer to the neurosurgeon. That is, I've wasted a lot of time. So it's important that we all know this. Right. Now, there's something else also happening on this CT scan. Hoping you may have noticed that if you look at this one, these are the